Good morning, everyone. Is my audio okay?
Yes.
Thank you. We're going to get started in just a couple minutes here. I see the numbers climbing. For those of you who have not met me before, I'm Melissa Tortolot. I lead the marketing communications team along with my colleague Ken Roberts from Arnett. And we are so excited to have you logged in this morning for our first inaugural Centralus Health Town Hall. Looks like we've got almost 300 people here, Dr. Stallone. I think we should maybe get started.
We get started?
Yeah, I think so. I'll
Well,
pass the baton to you and to Mr.
absolutely.
Lawrence.
Absolutely. And I'm here with Jonathan Lawrence. To introduce myself, my name is Dr. Marty Stallone. I guess we have new titles now. I'm the CEO of Centralus Health, but you guys know me as the CEO of Cayuga Health. I'm here with my colleague and friend, Jonathan Lawrence, who's going to introduce himself in a moment. But I wanted to start by wishing everyone a Happy New Year. I hope that the holiday season was restful and that people had time with friends and family to recharge and do some things that whatever's important to you. And we're going to hit the new year running. But I do want to allow Jonathan to step up and introduce himself, and then we'll get started, and I'll share my slides when he's done.
Good morning, everyone. I'm Jonathan Lawrence, President and CEO of Arnett Health, and now Executive Vice President of Centralus. I'd also like to welcome everybody to this inaugural meeting, much anticipated. A lot of work has taken place to bring us to this place and time, and we're all looking forward to the future with anticipation and enthusiasm and a sense of optimism that I think is appropriate and warranted. And we'll begin talking this morning about why that is. So glad to have everybody here. Thank you.
That's awesome. And again, thanks everybody for taking the time to do so. I'm going to share my screen and just make sure that that actually works. Melissa, can I get a thumbs up when you, okay, it's all in the right format here. Okay, and today is January 6th. We have shown this slide recurrently throughout our time together. We're proud to finally share the news that Arnett Health and Cayuga Health are officially affiliated, and that affiliation date was January 1st. At this point, we're now allowed to reshape how healthcare is delivered and enhance the lives of the people we serve as partners. Cayuga and Arnett and all of our affiliated businesses, and again, Cayuga and Arnett are a collection of businesses themselves, we operate as members of Centralus Health. This partnership is built on shared values. It's based on a deep commitment to our communities. It's based on an unwavering focus to improving access to high-quality medical services in the Southern Tier and the Finger Lakes. And really, this has been a more than 12-month journey. If you're not involved with it, it's hard to imagine the many hurdles that organizations need to go through: the meetings with the Department of Health, the meeting with all of the other regulatory agencies, elected officials, local businesses, interested groups, review committees. Really is a monumental, greater than 12-month effort. But again, we're here, and we describe this as kind of a finish line, but in some respects, it's a starting line with our journey together. Jonathan?
Okay. Thank you. So we know that health systems across the state are facing unprecedented financial pressures and continuing workforce challenges. This affiliation allows Arnett and Cayuga to benefit from our combined expertise and scale. In addition to many other benefits, this will enable us to reduce our operating costs through shared services and group purchasing. And while the volumes that you see on the screen are large, we're going to remain focused on meeting the needs of every patient who has trusted us with their care. Our affiliation is going to be more than just about combining our resources and streamlining processes. Centralus Health will be focused on building something greater than the sum of its parts.
Thank you, Jonathan. So at this point, you've been wondering, and many of you have participated, so this might not be a total surprise to everyone, but we're going to share our new identity before we roll this out at tomorrow's media events. We want our community to get a sneak peek of what's to come and the rationale behind it. Once this news breaks tomorrow, which we're going to be hosting in Elmira and Ithaca, we want all of you to share the exciting news with your own community by social media or just word of mouth, or wherever you're most comfortable. So without further ado, we'd like to present the new logo and brand narrative around Centralus Health. And we're going to be talking about this a little bit, and hopefully this is something that will be a source of pride and identity for everyone. So Centralus Health, which is the name of the parent company that's coordinating the two health systems, is an affiliation of ARNET and Cayuga. Centralus is focused on providing for our region's changing needs and well-being. As Centralus Health, we're going to continue to treat the whole person, and you'll hear that again and again, because we know that prioritizing individuals creates stronger connections, better outcomes, and healthier communities. Centralus is more than a group of experienced caregivers. It's a partnership of advocates who strive to eliminate barriers to better health. We innovate and evolve services in our communities for enhanced holistic care close to home, and that's important. We are all about imbuing more care locally, high quality and accessible care locally to communities that benefit from it. And beyond clinical outcomes, it's strengthening community connections and setting a higher standard for quality that's exceptionally personal. So Centralus Health is central to wellness for all of us. And I know Jonathan's going to maybe say a couple of words about the logo and what's behind it.
Yeah, an awful lot of work has been done to come up with this logo and to come up with the brand promise. So that description of the brand, as Marty speaks it, is intentional. As you're going to see, those words in this logo were developed with input from many community members, employees, our respective boards of directors, and the design team would describe this as a medical cross that is formed from interlocking organic shapes coming from a central point. And they will tell you that the leaves are representative of our connection to the rural landscape where we work and deliver care. Future outward animation of the leaves will represent Centralus Health as a catalyst for growth in the region. And the friendly, softer typeface that was used to echo the way that we interact with those that we work with and care for. And so for the foreseeable future, the Centralus Health logo will appear with both the ARNET Health and the Cayuga Health logos as we work to establish the brand in the mind of consumers.
Thank you, Jonathan. So this was done at the same time we analyzed, what is the organization going to stand for? What's the purpose of the organization? In other words, what's the mission of the parent company? And Cayuga and ARNET came together with very meaningful mission statements. And there was a great effort to think about our mission, our vision, our values. And I'll just share, we did a lot of analysis. We, especially on the values, which I'm going to talk about in a second, brought the opinion of our larger communities together and really incorporated a lot of ideas. But our mission is to deliver high quality care, empower our teams to succeed, and improve the well-beings of the communities we serve. And so as part of the social fabric of our communities, we're a thread that weaves connection and support. This takes the best of who ARNET and Cayuga are as foundational organizations for our communities, and focuses transforming care in the region as a chief priority. Our promise is to deliver high quality personalized care equitably and close to home through the growth of a best-in-class integrated delivery network, which is in essence our vision. And so Centralus Health is going to continue to make capital improvements and operational improvements to facilities and investments in the healthcare workforce. We're going to continue to offer specialized services throughout our communities, and these services might not otherwise be feasible to sustain without this partnership. This is a subset of a growing list of comprehensive services that include, obviously primary care and emergency care, critical cardiac care, cancer care, inpatient acute care, outpatient physician care, so all of the different subspecialties that exist within AMS and CMA, inpatient and outpatient behavioral health, substance use disorder, long-term care, home nursing and durable medical equipment, and emergency transportation. And again, this is not a full list. In a recent application that we jointly submitted to the state, I counted over 70 services that that we offer, and that wasn't even totally inclusive. So I think we're very proud of the breadth of services in the primary and secondary space that we offer, and this will be a focus for Centralus going forward to sustain that and grow it.
Okay. So as everyone knows, we're already making technology improvements together. On January 1st, Workday went live for finance, and this will ultimately create many efficiencies and improvements to our financial reporting tools and the many aspects of supply chain management, and ultimately next year in human resources and other elements of the Workday application. Right now, we're also marching toward the final steps of implementing Epic, the best-in-class electronic health record that everyone knows will go live at Arnott Health and Cayuga Health on March 22nd. Epic promises significant changes to process, to workflow that will improve the patient experience and our experience as members of the workforce. It will reduce errors. It will support improved patient outcomes through integrated data and decision support. And it will really transform care. It won't simply be an incremental upgrade to what we're doing now. I think it will be transformational. Additionally, for our patients, scheduling, communicating with their care team, and bill paying will become easier through the MyChart patient portal. Effective tomorrow, the day of our media conferences, the Centralus Health website will connect the existing Arnott and Cayuga websites, and service content will be migrated to the new website as services integrate their practices. In March, the Physician Finder currently on both sites will be integrated and powered by Epic. These are just two of the many examples of how we're going to pool our knowledge and our resources to make high-quality healthcare more accessible, more innovative, and more equitable for the patients that we serve.
Thank you, Jonathan. And I do want to just point out, when I first spoke with Jonathan at the very beginning of our journey toward affiliation, Jonathan was keenly intent on bringing Epic to Arnott. And I just want to recognize that that was an early intention that he made very clear. And so it's nice to see that coming to fruition. Back to Centralus. I think there's going to be much opportunity to celebrate the coming together of the organizations. Obviously, our website, as Jonathan mentioned, is going to be launching concurrently with our media announcements. And again, we're sharing with you all in advance of that so that there's no surprises to our community. We're going to have swag vending machines at multiple locations and an online swag shop. So you can identify with the Centralus Health brand, which again is going to accentuate the Cayuga and Arnott brands. Shortly, we're going to be giving email signature update guidance so that in your email signatures, if you have a title, you can identify with being a member of the Centralus organization. And then leaders are going to be rounding to virtually all locations. Our goal is to get to everywhere in January and February and hear what the thoughts are on the ground. And just in terms of who's going to be rounding, we want to just say it's leaders in the clinical, operations, finance, people, and technology space, in addition to Jonathan and myself. And while this is not the formal Centralus org chart with the straight lines and the dotted lines, these are the leaders who are in charge of implementing integration efforts, which we are on the record of saying we've done a monumental amount of work calculating what's possible and where value can be created. And so these leaders architected those plans that ultimately our boards of directors approved, and they're going to be rounding at facilities and making sure that everyone is aligned and understands our purpose, the purpose of the organization, and that the finger is on the pulse, so to speak. So they're also going to be in charge of sharing our corporate values. And so hopefully welcome them if they come around, and hopefully these names are familiar to everyone. I'm not going to read everyone's name, but these are the main people who are in charge of integration. So I mentioned the mission, and I alluded to our vision about being a best-in-class integrated delivery network. There's also been a lot of work on what are the values of Centralus? What do we stand for? How do we want to do business? How do we want to serve our communities? And so our values were thoughtfully developed through the contributions of numerous individuals across the organization. I really want to credit the leadership teams who, again, asked literally hundreds and hundreds of individuals, and I'll go through the details, but we deeply value their input, and our organization can take pride in what we've created. And so in-depth interviews, employee focus groups, including 55 employees, 325 value phrase submissions with over 8,000 votes. So when I said that there were thousands of people, there truly were thousands of submissions. We did a consumer survey. We conducted in the service area footprint, 277 consumers from the community outside of our employee gave inputs about what we should be. And then, of course, secondary research happened as well. So publicly available data and market research data provided by Cayuga and Arnott. And so, again, a monumental amount of effort went into this. There was a cultural design steering committee, and those leaders were listed here. These are the leaders who really were the sponsors of the work. There was also a cultural design project team whose names are listed here. And again, there were 55 employees who participated in focus groups. And again, 8,000 votes from the crowdsourcing efforts that we accomplished. And so without further ado, our shared values, as defined by you all, are as listed on this slide. And starting with people first, and I'm going to read these. We care for the whole person, knowing that prioritizing people creates stronger connections and better outcomes. Next, integrity, consistently doing what's right, fair, and just, even when it's difficult. And we are faced with difficult decisions on the usual. Compassion, treating every person with kindness, dignity, and respect. Excellence, we're committed to performing every task to the highest standard, believing that how we do anything reflects how we do everything. And then finally, stewardship. We honor our mission by managing our resources wisely, ensuring we can serve our community today and for generations to come. So we're going to be working with each unit to create an environment where empathy, honesty, and dedication to quality thrive, empowering us to make a positive impact on the lives we touch. And really what we want this to help us do is guide us in how we act. So we want these not to be words on a wall. We want to really bring these into how we serve our communities. So we want it to guide decision-making. We want it to enhance employee engagement, integrate into performance evaluations. We want to reward those individuals among us who demonstrate these values and how they act. We want this to shape leadership development. The leaders that we empower and appoint should be fulfilling this on a daily basis. They should be continuing these ideals in the units that they lead. And then we want it to influence policies and procedures. So really, we want these values to be alive in the organization. Now, what's next? This is a confusing time. A lot of people are still wondering, what does it mean to be part of Centralus? And while I think this is hugely important for the region, and Jonathan and I can go on and on about why this is critical for the organizations to have done this, at the individual level, not a lot has to change. At the end of the day, it's doing your job well. So at the Cayuga side, I put strategic lenses as a way to think about our strategic plan. And first and foremost, every individual has to fulfill their role with excellence. We expect excellence at the tactical level in how we do our day-to-day job. And so for the floor nurses in the inpatient units or the providers in outpatient clinics, your job is to still do that very well. Our focus broadly is to optimize operations for sustainability. It's not enough to just do our job. We have to think about ways to do our job better. We have to think about being sustainable for the future. And so that is an expectation where leaders from time to time will ask us to find better ways to do our job. And then in addition to our day-to-day job, we have to do new system implementations. The investments like Workday and Epic are things that we all have to participate in because it's healthy for the organization. So as we kind of finish the presentation part of this and take questions and try to field some answers in a moment, as we walk away, we want to simplify what the marching orders are, so to speak. So it's do your job well, think about how to do your job better wherever possible, and prioritize new system implementations. And so while there's great change happening at the individual level, I want to simplify it and ensure everyone knows we can do this. With the 8,000 wonderful people across both health systems, Jonathan and I are supremely confident that we can succeed. We've got great people, we've got a great plan, we have great resources and tools coming, and the future is bright for Centralus. With that, I'll say our team is eager to work shoulder to shoulder to realize our shared mission of delivering outstanding care in the region. Again, we're confident this affiliation is going to positively impact our patients, employees, and the broader community. And I want to thank you for your interest and belief in what we can achieve together. And now Herb Alexander, who is expert in doing this, is going to field questions from staff and pitch them back to Jonathan and I. You'll notice, and I should have said this at the beginning, the majority of our leaders are present. And so as usual, the ground rules are, if there's a question that Jonathan and I can't answer, we will ask one of our teammates. But I do want to emphasize the focus is on the affiliation. This is not the forum for very specific questions about one thing or another. We really want today to be about the affiliation. So Herb, if you're there, I'm going to stop sharing my screen and just say that the next town hall is going to be on February 12th before I stop sharing my screen. Take a note of that. But I'm going to stop sharing now and let Herb take it.
Perfect. Dr. Stallone, can you hear me okay?
I can.
All right, great. Well, I'm glad to be here, excited for this day. For folks who have not had the chance to meet, my name is Herb Alexander, and I serve dual roles. I'm the Assistant Vice President for People and Culture, and also the Chief Diversity and Health Equity Officer. I'm glad to be able to facilitate today's discussion. And so we'll keep it high level about the affiliation. And as usual, if we don't get to any questions, we'll make sure we take those back and find another way to communicate the answers out to everyone. Is that fair, Melissa? Okay, great. So first, could we just give some clarity for folks? When we say Centralus Health, Dr. Stallone and Jonathan, what are all of the entities that we're referring to and facilities?
Basically, it's everything that was formerly part of Cayuga and Arnett. So if you were to draw this on an organizational chart, this is not the people chart that demonstrate the leaders. If you talk about the organizations, Cayuga Health was the active parent over Cayuga Medical Center and Cayuga Medical Associates and Schuyler Hospital and Cayuga Medical Equipment and all of the other 30 companies, and same with Arnett. Just think of Arnett, Centralus being above Cayuga Health and Arnett Health, and really the purpose is to coordinate integration. Just the same way Arnett Health coordinated the organizations within that health system. So really, we're talking about two health systems coming together, but the individual organizations under it remain discrete organizations in the eyes of the state. So Cayuga Medical Center, for instance, is still a hospital licensed in New York State. Arnott Ogden Medical Center is still a hospital licensed in New York State. So this is really affiliating, not merging, but affiliating all of the organizations that were formerly and continue to be in Cayuga Health and Arnott Health. And if anyone wants to amplify, feel free, but hopefully that hit it.
Like, that's good. Thank you for that clarity. And then, Jonathan, I do want to maybe start with you and then go back to Dr. Stallone. What can people expect over the next, let's say, 30 days, 6 months, and a year, right, as far as gradual changes to how we do day-to-day business?
Well, I think as we said, probably the most visible things are going to relate to our technology improvements and the work that we're doing together around Workday and Epic. In the background, though, and for many months, we've been doing other things together. We've been sharing some other resources and services where opportunities have presented themselves. We've taken advantage of the fact that perhaps you've had clinical services or a provider that has availability where we have need, and vice versa, where you may have an organizational need for someone in a personnel capacity, and we have that capacity to be able to share. So we've done this in the Cancer Center. We've done this with our foundations. We've done this, I think, in a couple of other departments where even just collaborating without a formal contractual arrangement has been helpful, sharing intellectual knowledge as well as policies and procedures, and beginning to talk about the future to the extent that we've been allowed to. We've been constrained because we've been legally constrained because we haven't been formal affiliates. But to be able to begin the planning of how do we leverage our collective resources, knowing again that, and we've said this, many times individually. So for the avoidance of any doubt here, we also struggle, both organizations, with workforce shortages. And unlike other affiliations, and the analogy I've used is like two bank branches that are right next to each other. And one of them has to lay off a lot of people once they come under one heading. That's not what we envision here at all, and that's not how we see our success in the future. It's by being able to reduce our need for additional personnel when we have folks right here within both of our organizations, and then be able to grow services to meet unmet demand, and then add people accordingly once we fill the available spots with the folks that we have within the Cayuga and Arnett system. So I don't think that there's going to be a lot of duplication. We don't see that. What we see is that there are needs on both sides that the other can help fill. And there are also needs between both organizations that we both have that we can fill together.
Yeah, thank you. That makes a lot of sense. So for a long time, there was a boundary or some things we could not do legally, but now that's no longer because we're officially affiliated. So we can start to realize some of those plans that we put together in place. And Dr. Stallone, I would ask you same question for the right now, but then maybe you could also speak to what's coming in 6 months and a year.
Sure. And really, just starting from the last slide that I spoke to, which are really what we want to think about kind of going forward, is everyone needs to do their existing jobs to the same level of excellence we expected yesterday. So if nothing else, continue what we're doing. There's still patients to be served and demand for those services throughout the region. But then almost immediately there's an opportunity, but not a compulsion, to integrate the way we do things. And so the great example was we went live with Workday so that there is a unified way that all organizations under Centralus Health purchase services. That's a great, easy one to have done. Now, it's remarkable that we were able to go live with Workday on the day that the affiliation happened. That's breakneck speed in that domain. I would say for other opportunities as they present themselves, they may be coming to fruition in a year. So if there's two similar business units in Cayuga and Arnett Health, when vacancies exist, we can stop and think, well, how can we organize ourselves more efficiently? How can we bring things together? Epic, we've said this again and again, but that's going to provide unified ways of delivering care, because it's not just a place where we reposit medical information, it's built-in workflows for how we provide inpatient care. So the processes that exist in Arnott Ogden Medical Center or Ira Davenport are going to be similar to the processes that exist at Cayuga Medical Center and Schuyler Hospital. And that's going to happen in March. So you see Workday now, Epic in the 3 to 4 month period, and then a business units to be defined who have leader vacancies, or they find a common problem that have now new partners and a new way to handle that at the 6 to 12 month period. I hasten to say nothing is compulsory, but I will tell you, we need to act with a sense of urgency, because we do need to accomplish efficiencies. We do need to find better ways to do things. We do need to improve our respective organizations. So our leaders are going to be instructed to be on the lookout for ways that we can work together to do things better. That's my directive to all of the leaders who are on this call and who are not on this call, is that you need to leverage the breadth of the Centralus organization to solve problems. So hopefully that gave a little more color to your question, Herb.
Yeah, that was great. And I appreciate the end. Things won't be compulsory, but my former basketball coach used to say, go quick, but don't hurry. And so we're looking to move fast to make sure we are diligent in that way. And I also appreciate we have some very defined things. So we have Workday is live now, Epic in March, and then the Workday Human Capital Management System in 2026. So that makes sense. Appreciate that. So Melissa, hopefully Dr. Sloan and Jonathan don't mind me coming to you really quick for some like rapid fire questions I see in the chat here. So will there be talking points about how we can talk about the affiliation for folks across the organization at some point?
Absolutely. There's going to be lots of information that'll be continued to be shared through our intranets, our weekly newsletters, and the messages out to our directors and managers to help people understand what it means to be part of Centralus Health. Really, it's not any different than how we talk about today, Ira Davenport as part of Arnett Health, or Skylar and CMA being part of Cayuga Health. This is, there are different levels of organization and business units in the way we work together. So when we talk about, I work for Cayuga Medical Center, but it is part of Cayuga Health, you can think of Centralus Health in the exact same way. It's just eventually we will probably minimize the emphasis on Arnett Health and Cayuga Health, but that's not today. There's a lot of great brand equity in those names. So there's no need to feel like you have to rip some Band-Aid off and those are never to be said again. You'll continue to see those logos on our signage for an undetermined extended period of time. You'll still see that on your badges and in our letterhead. We will be sending out updated email signatures for folks though, because we want to add a line to those logos that says Arnett Health, a member of Centralus Health. So it'll be a little tagline at the bottom. So when you see email signature changes are coming, it's really as simple as updating that little piece of art. Of course, Dr. Stallone and Mr. Lawrence mentioned that there are a few leaders who will be having Centralus specific roles, and those folks will work with them because they may use the Centralus logo to define their roles. But for most folks who are on the call today, it's really just going to be a slight change to the logo, which is a nod to the membership in the larger Centralus Health organization.
Perfect. So when folks ask, because this is in the Q&A box too, where do we work? Do we say Centralus Health or the respective health system they work at? Can it be either or should it be more
I
specific?
think both are appropriate, and I think it just depends on who you're talking to and what you think they're trying to learn. Obviously, we want folks to start talking about Centralus Health. So my ideal answer would be like, I work for Cayuga Medical Center. It's part of a larger health system that just recently formed, Centralus Health, and we're looking for ways to do things better in a way that's super focused on our community and individuals and providing a wide breadth of services right here where we live.
Perfect. Thank you. And then Melissa, I forgot to say at the very beginning, for folks who joined at the very late, because you did introduce yourself at the beginning, could you reintroduce yourself too?
Sure. I'm Melissa Tortolot. I am the Vice President of Marketing Communications for Cayuga Health, and I'm leading marketing communications for Centralus Health with the support of my friend and colleague, Ken Roberts from Arnett.
Perfect. Thank you. All right. So Dr. Stallone and Jonathan, back to you. So folks are asking, now that we're officially affiliated for our Joint Commission and New York State Department of Health surveys, how will that work moving forward? Would that be a unified process or still a separate under the health system?
Well, strictly speaking, the focus of analysis is on the entity, and the entities are all intact. And so each organization is going to be inspected and reviewed independently. So CMC and Skylar Hospital, for instance, will continue as they are now to be inspected kind of independently. They receive kind of separate accreditation reports, and same thing with Ira Davenport and Arnott Ogden Medical Center. But all of the programs that exist separately stay separate. And we can seek to combine things over time, but for now, everything remains separate. Again, envision that coordinating company, Centralus, that sits on top of everything, but nothing changes in a compulsory way under that.
I would just add, Marty, but now we have the benefit of being able to coordinate and plan
Yes.
and share knowledge and experience from those surveys and those credentialing processes and our responses to corrective action plans and so forth.
That's
So with our scale comes greater intellectual capacity, experience, and talent.
That's right. Well stated.
Thank you. Do we see the affiliation being adding any benefit to the idea of recruiting and then also retaining staff, specifically providers? And then do we see that leading to greater access for our patients?
Well, I hasten to say this has already happened. We have jointly recruited a vascular surgeon that intends to provide services across Cayuga and Arnett. I will say on the Cayuga side, we have wondered if our health system size and the market demand of Cayuga alone would support that kind of a provider. We are very confident that together with Arnett, there's sufficient demand for that kind of a provider. So absolutely, I think provider recruiting and the ability for a larger organization to support more specialized services is a key benefit to the organization. I know Dr. Hennigan was key in that. Do you want to add to that, Steve?
Yeah, I was part of that recruitment. I think the sense of a larger organization was key to recruiting a talented leader and physician. And I do anticipate it helping for future recruitment in all arenas. So I'm looking forward to it.
Perfect. Thank you. And I can imagine, I know we spoke specifically about providers, but that can probably go for across the board as we look to recruit and retain staff in that way. So great. Okay, so there was some excitement I see around the shared values and the shared value slides, which is great. And there's a question within this question, so Melissa, I'll go back to you. First, Cayuga Health launched the Pulse, the new intranet recently. Will those or are those intranets be united as far as Arnett also having the Pulse around Cayuga to be Centralus Health's intranet? Has that happened or will that happen in the future?
So fortunate for Arnett Health, they had a much more advanced intranet to start with, but there is still an intention than we had at Cayuga, because those who are using that, we know it was held together with bubble gum and tape. So we're very excited about the new intranet. And yes, the Pulse will be the intranet for all of the entities under Centralus Health. And Ken and the rest of the team and I will be working on hopefully getting that live and integrated later in the first quarter, beginning of second quarter. So more to come there. But of course, it'll take some time as content needs to be integrated as well. And that will include many people beyond Marcom in the individual departments vetting materials and make sure that the information we're sharing on the internet is accurate and up to date for everyone who accesses it.
Perfect. Okay. So in that case, then the shared values that we showed today will be distributed in other ways, including the intranet, but that won't be available to folks on Arnett yet, unless it's also on.
So actually, we have been in practice of sharing materials in tandem over the last year with the Epic rollout. So we have a pretty good internal mechanism. Marcom and the marketing team over the Cayuga Marcom team and the Arnett Marcom team have been working hand in hand for months and months and months to support shared communication. So we use our existing platforms and make sure we stay in step on both sides. As we have for Epic and Workday, we have the same message versioned for both sides and pushed out simultaneously. So everyone will be able to see this presentation will be shared on both sides as a recording later this week. And then we'll, of course, also share the values. Herb, I would love to turn the question back over to you to talk about how we plan to do some education for leaders. Do you want to talk a little bit about that around the values?
Yeah, so we will, there's a rollout plan around specifically that fourth bullet under the share value slide or post the share value slide that says leadership development. And so there'll be education training on one, how do we embody these on a regular basis? So what standards of behavior should we be living up to? And again, these are things that all of us created, right? So it's not being done to, it's being done with all of our folks on this call here. But then also not just how do we embody those, but then how do we leverage those with our teammates and team members to drive performance in the best way possible, right? And to improve culture, and most importantly, to measure that. How do we know that the values that we've decided to roll out are actually having an impact on people's, the psyche of our individuals, but also the way we provide patient care, work with our teammates, all of those things. So that'll be rolling out over the next year, but it can't stop there. So it had to be a regular, continual basis with that. And so myself, Elizabeth Belize, who's on the call as well, who's our chief people officer, and others will be continuing to build these into the fabric of what we do. But thank you. I appreciate the flip question right there. Keep me on my toes. All right. So this might be for Jonathan or Dr. Stallone, but Rob as well. Where does Extensis fall under Centralus, and how can we expect those entities to connect?
Uh,
Go
I'll,
ahead,
I'll
Rob.
take that one and then you can add to it if you want,
You got
Marty.
it. Yep.
So when Extensis was created, it was always with the expectation that the affiliation would proceed. And so the Extensis is a joint venture that prior to the affiliation was owned in part by Cayuga Medical Center, or a holding company owned by Cayuga Medical Center. And that's moving up to the Centralus level. So Extensis continues to be a joint venture. It's got outside interests and aspirations that will support it being successful. But the interest in Extensis moves up to the Centralus level with the affiliation.
Jonathan, Dr. Salone, anything you would add to that?
No, thank you. The point I wanted to make was that it's a Centralus benefit organization. Cayuga Medical Center held it temporarily until the affiliation, but the agreement was that it would be a Centralus-wide benefit. It's a way that we were able to begin the Epic and Workday journey as separate organizations, and great care was taken to compartmentalize efforts from Cayuga Health and Arnett Health. And so that was done very expertly by Rob and team. And then just to state something that is a fact, Excellus Blue Cross Blue Shield is a supporter of that entity, and our aspirations are to share the digital platforms that are best in class with other health systems and provider organizations throughout upstate New York. So we've got this rare opportunity to put everything shiny and new from a digital perspective. And the idea, just so everyone knows and can get excited about this, is that tools that are such best in class and frankly expensive are unaffordable for organizations who do it on their own. So if you think of organizations like Cayuga and Arnott, it would have been a stretch for either of us to do this by ourselves. And we envision a future where other health systems in the upstate region who similarly need to find paths to sustainability and to find better ways can share in that digital infrastructure. So, I refer to an extensive strategy. That's it. But this should accrue benefit to Centralus in the long run, because it's an alternate line of business when you really think about it. It's in keeping with what we do. It's the heart and soul of what we do, providing healthcare, but we can also help others to be successful in that at the same time.
Okay, perfect. Thank you. All right, so the question here, I'll restate something that Jonathan said earlier. So because of the way we have coordinated the affiliation, if we continue on the path that we've laid out, we do have the benefit of not having to do massive layoffs the way I think you referenced, like 2 banks that are next to each other, right, as an example, which is great. So now that we know that, what benefits, though, can we expect employees to see? Like in the future, do we see combined health insurance plans and being a network and things like that, right? What can we expect to see? And I'll pass it to you, Jonathan and Dr. Stallone. And then, of course, you can pass it to anybody else you see that can add to that question.
The short answer is yes, Herb. I would envision, and we've talked about, again, the value of scale here, the value of our size. It doesn't happen overnight, but the ability to share physician networks for our own employee health plans, certainly one of the benefits that we anticipate. The ability to be able to share, to combine insurance coverages for operations. We're reliant on many different types of insurance. These are overhead expenses. We expect our scale will be able to reduce the cost of that, and we'll be able to take a more sophisticated approach here, particularly in things where we're self-insured. Size is certainly important to reducing our risk. So I think, anything's on the table. It just won't happen all from day one. And we'll do it in a way that makes sense in terms of both the timing and the outcomes that we're seeking to achieve.
I would add to that. I agree with everything that Jonathan just stated. There's also the idea of cross-fertilization and a bigger organization for more opportunities within that organization for people to explore and avail themselves of. So I know in Cayuga Health, there are opportunities in some units that act as feeder units to other parts of the health system, for instance. Now just think of there being a larger organization to move into, greater specialization of support services for employees. So as we get bigger, there's greater specialized services in the space of benefits and specialized recruiting. So I think in terms of the jobs one can do and the support that employees have for any one of a number of issues, it would be enhanced in a larger organization. And again, larger isn't always better. I do think there is a sweet spot that I think we've got a very nice size between Cayuga and Arnott coming together. Because if you think about, the 8,000 or so employees, well, I personally believe that when you get to 20 and 30,000 and you're delivering healthcare in communities, there's diseconomies of scale in some ways that actually creep in. So I don't want to say bigger is always better ad infinitum. I think that we want to retain the localism, if you will, the focus on the person, which is expressed in our values. But I think on where we are along the continuum, bigger is needed more than the downfalls of bigger.
Good, thank you. I really like this question because I think this is for both organizations a bright spot for things that we do. So, and this I'll start off again with Dr. Solana Jonathan, but maybe Dr. Mike Berlin can add to this. So for our residency programs, which is at both organizations, will folks still continue to work and exist within their respective organizations? So Arnott Health, Cayuga Health, or will we see some cross-pollination of the programs going forward and in the future?
Well, I can just take a stab. Both those programs again are separately accredited by ACGME. So we can't just say day one they've combined. But I think there's certainly interest in taking a look at where we can expand residency opportunities under either of those programs, or practical education opportunities, not only for residents, but for nursing students, for PAs, NPs, for others. We also run a paramedic program. We run a radiology tech program. So we have a continuum of educational services, as I know Cayuga does too. So where can we provide additional experiences that help grow the workforce and provide additional opportunities? Mike, you have some other thoughts in terms of residency, or Steve?
No, I think that's perfectly said. Separate, but lots of opportunity where it's available.
I would say Dr. Berlin and Dr. Witt have just in the last month have collaborated on using the Cayuga neurologist for training. So just an example of we're going to have separate programs, but I think the clinical footprint allows for better education.
Mm-hmm. Perfect. And so going into just something that we could lean into more, we talked a lot about what's happening and the benefits internally, but maybe to some of our clinical folks and maybe even specifically nursing, what do we see as the benefits, or what benefits do we imagine for direct patient care, either immediately or in the future?
Marty?
I think enhanced and more perfected protocols of care everywhere. There's going to be the ability to navigate patients through the system more seamlessly. So we talked about MyChart and the benefits in scheduling. We talked about, the idea of an outpatient provider seeing into the hospitals and seeing what's happening. All of that leads to, hopefully greater continuity, less chance of information staying in one pocket and not reaching who needs it in a timely way. I think from a population health perspective, we'll be able to be more efficient for the community, which, by the way, leads to lower premiums, which leads to lower employee contributions. Like if you actually think about that being an employee benefit as well. So I think there's, being a high quality integrated delivery network with all of our parts working in concert with each other. There's benefits for all stakeholders, from the patients to the employees to the community and the employers that we serve.
Yeah, I think we see this most clearly in areas, there are small areas where we have overlapping service area. For the most part, we're very distinct in the regions and the communities we serve. But when you look in Schuyler County and Watkins Glen, I can tell you the community members there are excited about this because many of them rely on both organizations to provide their care. The fact now that they could be receiving services from both locally and will have Epic and MyChart to be able to help share information among providers, and they won't have so many barriers to scheduling and coordinating communication between their providers. This is going to be tremendous. The other thing that occurs to me, I know there was an issue at Cayuga with the cath lab recently. We were able to accommodate a number of patients readily. And that could happen here on any given day as well. We have older infrastructure where we haven't replaced all of the critical clinical equipment that we envision replacing and updating. And on any day something doesn't work or there's an issue, it's very nice to be able to pick up the phone and know that we have somebody else in the family that's going to be taking those patients and seeing that as part of their mission as well.
Good. Deborah, Dr. DeLima, Dr. Hennigan, anything you would add to that?
I think there are opportunities for our community members to stay in their community. For instance, we've had some cancer care, some oncology care, and I think the oncology teams have collaborated ahead of most areas clinically, where we've sent Elmira patients up to Ithaca to get second opinions and some care up there that they would have had to travel longer distance before. So I think that's a start of what we can keep in our communities.
All right, so with this question, I think it's a good one to maybe even zoom out some to answers on a high level. And so Evie or Elizabeth, can I go to you and maybe Diego as well? I think the question is getting at, as folks within our larger system now start to look at roles within, let's say I'm at Arnett and I go to work at Cayuga, right? And vice versa, and all throughout the different variations of how that could work. Will we honor length of service and the things that go along with that, whether now or in the future?
That's a great question, Herb. Thank you. So right now, best practice is when two organizations come together in a similar fashion as we are coming together. The best practice is to honor tenure and length of service. So now that we are affiliated, and that curtain between us has been opened, we are going to be having conversations around how do we facilitate that? How do we facilitate honoring things like years of service? So now that we will have complete access to both sides of that curtain, we're going to be able to make those decisions pretty quickly. But yes, best practice is to honor years of service. Now it's the how do we do that given all of the different systems from an HR perspective that we operate in. So the intent is always to do right by our team members. Now the question becomes, how do we facilitate that happening? So that's really what we're going to be working towards now and into the future.
Perfect. Thank you. Okay, so we have about 8 minutes left. There's been a lot of good questions. So obviously folks are curious and it seems like excited and all the other things that might be in between those two. So I'll pull out the last 3 or 4 questions. And again, if we don't get to everything, everybody, we'll do our best to get the answers to what's in the chat and get those out to you in different forums. So this one is about the leadership structure and senior leadership. And it's okay to, of course, say we'll get back to this if we don't have the answer yet. But as we go forward, the same way we describe either senior leadership or executive leadership, or whatever we describe that, how we decide what constitutes that group of people as we go forward. And Dr. Stallone, I'll start with you.
Well, sure. Well, first of all, I think we need to have a greater emphasis on making sure that when we hire someone into a leadership position, that there are certain attributes and responsibilities and subject matter expertise and that are required, and that we invest in growing that so that people internal to the organization have that opportunity. But in general, like any other position, you want to make sure someone like understands the scope of responsibilities and has the experience and the background and the ability to succeed in essence. And so, you know, there was a question I think that asked, how do people, are people going to have the opportunity to grow into roles? Absolutely. We will be investing in leadership training. Now, having said that, when we have existing individuals, who gets to be the person primarily involved in a responsibility, that ultimately ends up being my decision. The way we've gone about this so far is we've kept most people engaged in the topic, most people engaged in the responsibility, and we've looked at the facts and circumstances of each case. And I've spoken about this in town halls prior to today. And we've talked about complementarity, stage in career, interest in leading a larger group, subject matter expertise to do so. And so it's a complex analysis on a case-by-case basis for the individual's ability to fulfill a certain role relative to the needs of the organization. So there's kind of what we're looking for in growing and choosing leaders, but then there's the idea of how do we come together. I've referenced a merging lanes approach, where we have similarly qualified or positioned individuals in both health systems. And what we've done is made teams. We've made teams to figure out who is positioned, able, and inclined to take a leadership role, with an emphasis on teamwork and partnership. So hopefully, very complicated question to answer without a specific example, but hopefully those are principles that people can glean how we do business.
That's good. Thank you. All right, so I'll maybe do two more, and then we can close out. And again, thanks to everybody for asking all these great questions. So first one here is, Melissa, maybe I'll look to you and Ken to answer this, but how can folks start to, well, first obtain the information? So who, the leadership team, or what we're doing, where are the different entities, all of that information for our folks internally, where can they get that info? And then what can they start to do to share it? And is it okay to start sharing now?
Thanks, Herb. So the websites are going to be a great place where you can connect and see what services are at both places. Those exist today. And starting tomorrow, they will be connected through the Centralus Health website. Over time, more information will move from the individual websites up to the Centralus site as our operators integrate the services. As far as the leadership listings for today and in the immediate future, you're working with who you're working with today. We don't have any major announcements. As Dr. Stallone stated earlier, the team he shared today is really that integration team, and there's lots more work to be done. As we have information to share with different updates to roles and responsibilities, we're going to share that information in things like this town hall and in internal communications. So the town halls will continue together monthly. And then Ken, do you want to talk about the internal communications tools on the ARNET side of the house?
Yeah, we'll continue to use our newsletters, our intranet, our website, internal memos, and other means that we've always used. But I think the communication area is one area of affiliation where we're seeing benefits already, and we'll continue to see benefits. Combining the intranets, we'll have one resource, a shared resource, shared resources internally to manage that resource and push out information in a coordinated way. Similarly with the websites, our communities will have access through the Centralus website, and as we bring the other web resources together to access information on all of our combined medical staffs through the physician finder that Dr. Stallone had mentioned, will be available and managed through Epic. So a lot of exciting things and ways for our community and our employees to have access to information in a way that they never have before, and with much greater efficiency.
Perfect. Okay, so for our last question, we talked about a lot today. There's a lot of good questions. There's a lot going on. And so I just want to go to Jonathan first and then Dr. Stallone to say, with all of the information that we shared and all of the things that we talked about, what should people walk out of here, or what can people walk out of here thinking about today, and how could people be feeling about what's ahead?
Well, I think I'd sum it up this way. I'll tell you, I feel fortunate and grateful that we have within our immediate vicinity a capable partner that shares our vision and our values. I feel that way personally, and with my counterpart, and I feel that way about Cayuga Health as an organization. At the end of the day, Marty's job and my job is to ensure the sustainability of the missions of our respective organization. We are both very involved in regional and statewide health affairs, and we understand the challenges that so many other hospitals are facing. Again, I feel proud and grateful that we have arrived and executed a strategy here that I am very confident will sustain both of these broader institutions under the Centralus Health banner long into the foreseeable future for generations to come. I think that's the takeaway today, that together we're better, we're stronger, and there'll be speed bumps, there'll be challenges, but what we are doing here right now is ensuring the future of healthcare in a way that is aligned with our collective values for generations to come.
Absolutely.
I want to echo the optimism. We are similarly enthusiastic about what's possible as Centralus Health with the collective efforts of Cayuga and Arnott, bringing our community focus, the expertise of our people, and the worthiness of our missions together. So I think the sky is the limit for us. My takeaway message for the people on the call would be, don't worry about the complexity of it. Like, focus on the individual jobs that need to be done. There's people who are in positions who are charged with figuring out the details of the system. There's an overwhelming amount of information, and it's impossible in 1 hour to share all of what is possible to share. And my hope is that discussions like this, you can focus on the good and positive things that Jonathan just reviewed and that we agree with on the Cayuga side, and not let the questions and the unknowns cause angst. So this is a good thing for the community. That is the takeaway. We can do more together. And at the end of the day, we have to do our individual jobs to a high level of excellence. And that's what we're humbly asking people to continue to do. So thank you very much for your ongoing service, and more to come.
Thank you. Well, thank you all for the 600 plus folks who joined us today. If you just can't get enough of us, we'll be back today at 6 p.m. Using the same link, and we'll make sure that we will get back to the questions that folks asked that we did not have a chance to answer. Melissa, any closing comments before we get out of here?
No, that's it. Please encourage your colleagues to come tonight at 6. And also there'll be a watch party, a recording tomorrow playing at noon for those who weren't able to join us at either session today live. Thank you to all of my colleagues. It's so exciting for us to all be in one in one place. A lot of work that we've done and so much to come. Appreciate you all. Have a great day.
Thank you.